So what's happening with diabetes? Like, what's the problem?
It's high glucose in the blood.
Right.
In your body.
Yeah.
Expel it.
Yeah, right. Because basically, so yeah, if someone's diabetic, they have a problem with insulin. Either they don't produce insulin with like type 1 diabetes, or they're really insulin resistant, like type 2 diabetes. Like they produce a ton of insulin, but because it's not as effective, basically, because they've produced so much that the receptors have become less sensitive. And so, all right, so when we first filtrate from Bowman's capsule into this proximal convoluted tubule, we've got basically all plasma, okay? And so this has glucose, amino acids, water, solutes, pretty much everything, right? It's just like the raw filtrate, right? And usually during this part is when a lot of these things are reabsorbed back into the blood, right? Like glucose, because usually you don't get rid of glucose because you can always use it somehow. For energy, you can convert it to fat and store it. And so your body usually doesn't get rid of glucose because it's an energy source, right? And so usually like 100% of this glucose will go back into the blood. But what happens with diabetes is that in your blood, your glucose level is super high, right? And so this messes with the concentration, right? Or like the pressures, right? Because if there's a really high concentration of glucose in the blood, glucose isn't, because usually this is kind of lower, so glucose will want to go this way, right? But because we've got a really high concentration here, glucose won't go back into the blood, right? And so what it'll instead do is just kind of continue along and be excreted, right? But what this does is, because we have glucose in this filtrate, it's like hyper concentrated now. And so more water will flow into the nephron throughout the process, right? So because we have a ton of glucose, we're going to suck in a lot more water throughout this whole process. So we'll end up getting rid of a lot more water, right? And so, yeah, it more has to do with, we've kind of messed with these pressures, because these are like very specific pressures and stuff like that, right? And so it's, right, because remember we have like 300 here, like 1200 down here, right? But what happens is that when we have glucose in the filtrate, maybe we're already at like 1000 right here. And so we're getting more concentrated. And so water is going to go into the filtrate, right? Because it wants to go towards the higher concentration, right? And so instead of like getting rid of it here where we're supposed to, it's going to go the opposite direction. And then, yeah, we end up holding on to more water. And usually the blood pressure will be higher, and so you won't secrete ADH to hold on to more water because you have high blood pressure. And so this will just be impermeable to water, and you'll get rid of it, basically. And so, yeah, that's actually how they came up with the name, like diabetes mellitus, right? Because mellitus is like some Latin root for like honey or something like that. And so the urine is like sweet, like smelling or tasting, I guess. I heard in this class I'm in right now that like the Egyptians used to have somebody like pee on an anthill, and if the ants like come towards the urine, then you have diabetes or something like that. I was like, what? But who knows if that's true. But anyways, so yeah. Does that kind of make a little bit more sense? So yeah, and basically, because you're holding on to glucose, which you never do, all of a sudden you're throwing off all these pressures because you've just thrown the concentrations out of whack type of thing. And so you're going to end up urinating more. So, yeah. But your blood will be more concentrated and stuff, and so the thing is you'll urinate a lot, but you'll want to drink a lot too. So you'll have polyuria, and it's called polydipsia, is when you're like you're constantly thirsty, but you're constantly urinating. And because you're constantly urinating, you're constantly drinking, and so it's like it's not working. So the solution is to get insulin working, right? So that we lower this blood glucose so that we can actually reabsorb the glucose. And then our kidneys will kind of just self-regulate themselves. So.
How effective is this for diabetics? Because if one doesn't know they are diabetic and they start peeing a lot and they get rid of the sugar that way, that's how their body naturally gets rid of sugar, right? If their insulin isn't working?
Yeah.
Yeah. Okay. Is it pretty effective or no?
Well, the thing is,
peeing and drinking a lot, but
yeah.
is it gonna?
Well, yeah, it can start messing up a lot of different things. Because you're getting rid of so much water, it's kind of messing up the rest of your other body's functions because you're not able to retain water, basically. And so, and the getting rid of glucose isn't good. And also, because you're keeping the glucose in the blood, it's not getting to the tissues. And so the tissues are starved of energy sources. So they start trying to burn fats and proteins. But when you start only burning fats, you create like a lot of metabolic byproducts like keto acids and stuff. Heard of like ketoacidosis? You can basically like hyper acidify the blood, which then can damage pretty much all parts of the body. And so it's kind of like a snowball effect, right? It all starts with just too much glucose in the blood, but it like messes up your kidneys, which causes you to mess up your metabolism, which throws off your pH. And yeah, it kind of a lot of different problems. It can cause neurological problems, losing sensation in limbs and stuff like that. And so, yeah, you can't just really just have diabetes and just be fine. Usually you have to have some type of treatment because when you lose kidney function, you feel pretty sick. Like, yeah. It's not like you could just live a normal life. You'd like be really sick, and so you'd know something was wrong, or you would or you would just like die. So, I mean, yeah. But I mean, usually you can catch it before there's a lot of like symptoms for diabetes. So, but let's see. So, what else can we say about that? Yeah. But yeah, so your body normally doesn't get rid of glucose, and so it's kind of like that's how your body will get rid of it, but technically you're not supposed to. Yeah. So, yeah. Cool.